I'm Sarah Miller, and I was in a group with Emma Visser and Anissa Quintanilla, and we chose trachoma. So a quick overview of what trachoma is. Trachoma is a bacterial infection that affects your eyes, and it is caused by the bacterium Chlamydium trachomatis. Trachoma is very contagious and it spreads through contact with the eyes, eyelids, and also throughout secretions, which help infect the people. It can also be passed by handling infected items such as handkerchiefs. And at first, trachoma may cause an itching and irritation of your eyes and eyelids. Then you may start to notice like swelling and pus draining from your eye. And if left untreated, trachoma can lead to blindness. So some causes and risk factors associated with trachoma. Trachoma spreads through contact with discharge from the eyes or nose of an infected person. Hands, clothing, and towel and insects can also be routes of transmission. And other things like some risk factors such as poor sanitization. So people living in like close contact with each other in crowded living conditions and not constantly washing their hands have a higher risk of getting trachoma. Age also plays a part in trachoma, as children between ages 4 and 6 are more likely to get it. And then sex is also a risk factor, as women are more likely to get it compared to men, sometimes 2 to 6 times more likely to get it because they're around children more. And then for symptoms, some signs and symptoms of trachoma usually affect both eyes, and they may include mild itching and irritation of eyes and eyelids, eye discharge containing mucus or pus, eyelid swelling, light sensitivity, eye pain, eye redness, and then vision loss. And young children are particularly susceptible to infection, but the disease progresses slowly and the more painful symptoms may not emerge until adulthood. For diagnosis, your doctor may diagnose you, do a physical examination of just your eyes just to see if there's any irritation going on. They may also take a sample of bacteria from your eyes and then take that to a lab, but lab tests aren't always available in places where trachoma is most common. And then for treatment, in the early stages of trachoma, treatment with antibiotics alone may be enough to eliminate the infection. Your doctor may also prescribe this eye ointment treatment or oral Zithromax. And Zithromax tends to be more effective than the eye ointment, but it is more expensive. Treatment for later stages of trachoma, this includes painful eyelid deformities, may require you to get surgery. So an eyelid rotation surgery, your doctor makes an incision in your scarred lid and rotates your eyelashes away from your cornea. The procedure limits the progression of corneal scarring and may help prevent further loss of vision. Another surgical procedure that might be needed to be taken is corneal transplant, and that is simply if you have too much clouding in your eye, that is only when that one would be used. And then lastly is epilation, which is just removing your eyelashes, and that one may be needed to be done more repeatedly. And then for prognosis, we would need to monitor your symptoms just to make sure that it doesn't come back, because it can come back very easily since it's bacterial infection in your eye and you're constantly touching your eyes. You will need follow-up appointments just to make sure that none of your symptoms are coming back. And then preservation of your vision tends to be very good with trachoma if it's treated early before the scarring happens, just to help prevent blindness from happening. Prevention. So if you've been treated for trachoma with antibiotics or surgery, reinfection is always a concern. So for your protection and for your safety of others, be sure that family members of others or others you live with are screened and if necessary treated for trachoma. So in order to help prevent trachoma from happening, you can do things like face washing and hand washing. Change your pillowcase often because your eye will come into contact with your pillowcase, so just continue to wash that. And then don't use anyone else's cosmetics or personal eye care items. And then discontinue wearing eye contact lenses. And then also change your towel and washcloths daily. And that is where I got my sources, so if you have any questions, you can ask me.